Good evening, friends. Namaskar, dosto. I am Dr. Sanjay Kalra, your friendly endocrinologist, and you are watching Dr. KK's Med Talks, Thursdays with Dr. Sanjay Kalra. And आज के हमारे नॉन-स्टॉप शो का 600वां 600th एपिसोड है. So a great milestone for all of us. 600 KK Med Talks done, and many, many more yet to come. Let's have the headlines for today. Maharashtra eases restrictions as the Omicron wins, but the World Health Organization reminds us that COVID has taken a severe toll on mental health. 1 in 20 people actually are also likely to experience swollen lymph nodes as a side effect from a COVID-19 booster shot. So please don't worry if you experience such a thing. This will last for a short period of time and आप जल्दी ठीक हो जाएंगे. But bhari bharkam news. Bhari bharkam means heavy weight. And even with mild COVID, if you get mild COVID, even then, living with obesity may mean worse symptoms. So that means कि अगर आप ओवरवेट हैं, ओबीज हैं, आपका वजन ज्यादा है और आपको माइल्ड कोविड होता है तो वो इतना माइल्ड नहीं रहेगा. Symptoms will be more. And it just doesn't stop there. If you're obese and you get COVID-19, you are twice as more likely, 2 गुना चांस है कि आप हॉस्पिटल के आईसीयू में पहुंचेंगे, that you will need ICU support. अब इन भारी भरकम न्यूज स्निपेट्स के साथ लेट्स गो टू आवर टॉपिक फॉर टुडे. Our topic for today is living with obesity. Now, some of us are blessed. We do not live with obesity. But some of us are more blessed. We live with obesity. And in fact, come to think of it now, living with obesity. कुछ एक लोग जैसे मैं हूँ, मैं obese हूँ, so I live with obesity. I try to live a healthy life. But all of us do live with people who live with obesity. There would be no one in the entire world who doesn't live with people who live with obesity. And if living with obesity is so important, let's have some very important guests today. और आज का जो हमारा केके मेड टॉक्स है वो बहुत ही खास है. एक तो 600वां एपिसोड है, 600th एपिसोड, एंड दूसरा आज हमारे एक नहीं, दो नहीं, 3 गेस्ट हैं. So please allow me to introduce all our guests. Dr. T. Fessy Louis. Warm welcome, Dr. Louis. Dr. Louis is a senior consultant and associate professor at the Department of Reproductive Medicine and Surgery in Amrita Institute in Kochi. अमृता इंस्टीट्यूट आप सब जानते हैं, बहुत ही फेमस अस्पताल और फेमस मेडिकल कॉलेज है इंडिया का. बेस्ट कॉलेजेस में से माना जाता है. डॉक्टर फेसी लुई हैज आल्सो सर्व्ड एज द वाइस प्रेसिडेंट ऑफ फॉक्सी. फॉक्सी इंडिया की नेशनल फेडरेशन ऑफ ओबीगाइनी सोसाइटीज है. सो वार्म वेलकम डॉक्टर लुई.
Thank you. Good evening.
Good evening. People watching you from across India. We have people from the lay public, we have educationists, we have doctors. And namaskar, namaste, namaskaram to you from all across the country, sir.
Okay.
We also have with us Dr. Aparna Govil Bhaskar. Warm welcome, madam. Madam is a bariatric and advanced laparoscopic surgeon. Bariatric ये भी भारी भरकम शब्द है. सबसे पहले तो मैडम को यही बोलेंगे, bariatric का मतलब समझा दें हमें. She is one of the first surgeons in India to be accredited by the Surgical Review Corporation. And she is a surgeon at a center of excellence. And she got this accreditation so long ago, in 2011. Currently, she works with Apollo Hospitals, Mumbai. Warm welcome, madam.
Thank you, sir. Good evening, everyone.
Good evening. And we also have with us Miss Sapna Jain. Warm welcome, madam. Miss Jain, Vellore se hain, Tamil Nadu se. She took over her family clothes retail store in the year 2003 after completing her education. And since then, she has been running it, taking it from heights to heights to heights. Heights तो मैडम की बढ़ती गई, मगर एक चीज है जो उल्टी दिशा में गई. It went southwards. So that is her weight. The special thing about Sapna ji is that there was a time when she weighed 83 kg. She felt very unfit and lethargic. But she was involved in taking care of her parents. She became aware about the meaning of health, and that gave her the motivation to regain her fitness. And now what she says is, my journey towards remaining healthy continues to be a work in progress. So warm welcome, Sapna ji.
Thank you, sir.
बहुत सारे लोग हैं जो लॉग्ड इन हैं from across the country. Many comments coming in. रजविंदर कलसी जी कहती हैं कि stress also leads to obesity. So, Dr. Louis, you handle reproductive medicine, and
Yes,
people come to you seeking pregnancy, seeking completion of family. Are they under stress?
definitely. All the most of the people, when they're trying for pregnancy and not getting pregnancy, they're under the stress, especially in our country. I think most of the states, unless a few metro cities, the social pressure is more. Even in some metro cities, the social pressure may not be that high, but even the workplace, their relatives all have got social pressure. Now, the main problem for just I'm leaving alone the obesity is that once the age of marriage is delayed, once they are married, marriage is happening. What is happening is that they will not try for pregnancy. They will be waiting for a career to be established. And once they start trying for pregnancy, they will be worried once they're not getting pregnant. So actually, the thing is that the fecundity of one cycle is to 20% only. So coming to the obesity part, what it is related to the infertility. There are two important things. One is that obesity is associated with usually with polycystic ovarian disease, so the ovulation factor will be there. It is not that PCO is not that prevalent or something like that. PCO, polycystic ovaries, is in 20% of the women in reproductive age group if you do the scan, but their ovulation will be regular. So it is just like even if the ovaries are polycystic ovary, that means small follicles, the normal ovulation will be taking place. So once the normal ovulation takes place, that fertility is not an issue. But when those people increase weight, their insulin levels changes, insulin resistance changes. So definitely that ovulation part is getting affected. If there is no ovulation, the pregnancy chances come down. Even if everything is normal, one chance of one pregnancy in one menstrual cycle is 20% only. So that will come down. That is one thing. Second is that indirect effect of obesity, like it can affect the sexual activity of the individual can occur. So that means sexual function will not occur. That the frequency of intercourse will be less. So usually alternate day at least or weekly 3 times at least is necessary. So that will not take place usually because of obesity. That the sexual function, sexual habit is getting affected. So this is not only for females; it is for males also. In males, not only the sexual problem, it can affect the semen parameters also. I'll come to that once the discussion goes how the semen parameters get affected in obesity.
सो डॉक्टर साहब ये कह रहे हैं कि जो मरीज आते हैं, जो लोग आते हैं फर्टिलिटी ट्रीटमेंट के लिए, एक तो स्ट्रेस तो होता ही है उनमें, और स्ट्रेस और ओबेसिटी साथ-साथ चलते हैं। मगर उस ओबेसिटी के साथ एक तो एग्स की क्वालिटी लेडीज में ओव्यूलेशन जो है वो भी इम्पैक्ट होती है बिकॉज़ ऑफ अ डिजीज पॉलीसिस्टिक ओवरी सिंड्रोम। एंड दूसरा आदमियों में भी, पुरुषों में भी जो सीमन की क्वालिटी है, वो भी इम्पैक्ट होती है। और उसके अलावा एक तो एग्स और सीमन की क्वालिटी कम हुई, उसके अलावा सेक्सुअल ड्राइव, सेक्सुअल इच्छा और साथ में सेक्सुअल एक्टिविटी उसकी फ्रीक्वेंसी वो भी कम होती है। सो ऑल दीज वर्क टुगेदर टू एक्चुअली रिड्यूस फर्टिलिटी एंड टू कॉज जो सही इंग्लिश का शब्द है, जो लफ्ज़ है, वो है सब फर्टिलिटी। Dr. Aparna, you handle bariatric surgery and people come to you seeking treatment. Are they under stress? And एक क्वेश्चन जो आ रहा है ऑडियंस से, जो एक्चुअली बड़ा मुश्किल सा सवाल है, पूजा सिंह जी पूछती हैं, व्हाट इज स्ट्रेस टमी फैट? तो आर योर पेशेंट्स अंडर स्ट्रेस? डू दे हैव मोर टमी फैट? एंड ये टमी फैट का लिंक है स्ट्रेस के साथ क्या?
सर स्ट्रेस तो डेफिनेटली बहुत ज़्यादा होता है। आई थिंक ये एक विशियस साइकिल है बिकॉज वी ऑल नो दैट स्ट्रेस इज़ वन ऑफ द फैक्टर्स दैट लीड्स टू वेट गेन। एंड जितना वेट गेन होता है और पेशेंट्स बहुत कोशिश करते हैं, क्योंकि हम लोग बेरियाट्रिक सर्जरी करते हैं तो वी सी द टिप ऑफ द आइसबर्ग, पीपल हु हैव ट्राइड एवरीथिंग अंडर द सन एंड देन दे कम टू अस फॉर ट्रीटमेंट फॉर ओबेसिटी। तो ये वो पेशेंट्स होते हैं जिन्होंने दुनिया में जितनी भी वेट लॉस की के तरीके हैं उनको सबको ट्राई किया होता है। एंड स्टोरी सबकी सेम होती है बिकॉज बहुत जान लगा के ट्राई करते हैं और काफ़ी वेट लॉस भी हो जाता है। लेकिन जैसे ही प्रोग्राम को स्टॉप किया जाता है तो वेट वापस आ जाता है। एंड इसमें होता क्या है कि बहुत एक सेल्फ ब्लेम, बिकॉज एवरी पेशेंट दैट आई कंसल्ट स्टार्ट्स विद सेल्फ ब्लेम कि मैं कंसिस्टेंट नहीं हूँ। They don't understand the disease properly, and of course there is a lot of pressure from the family and from the society कि definitely अगर ये weight lose नहीं कर पा रहे हैं तो इनमें ही कुछ problem होगी, इनकी will power कम होगी. So that also builds up a lot of psychosocial stress around these patients. So it is definitely related to that. um, I am not sure about stress and visceral fat, a relationship between the two, but definitely, I think stress leads to weight gain, and by our genetic propensity, Indians definitely gain more weight around their bellies. So I think there may be a relationship between the two.
थैंक यू मैडम। मैडम क्या कह रही हैं कि एक विशियस साइकिल क्रिएट हो जाता है। विशियस साइकिल, अभिमन्यु का चक्रव्यूह इसे हम कह सकते हैं। स्ट्रेस लीडिंग टू वेट गेन लीडिंग टू मोर स्ट्रेस लीडिंग टू मोर वेट गेन। और इस चक्रव्यूह में से निकलना बड़ा मुश्किल है। अभिमन्यु भी थे महाभारत में, अंदर तो वो घुस गए, बट बाहर कैसे निकलो, वहां पे दिक्कत आती है। So, Swapna ji, a question for you, and this comes from Manmeet, and I really empathize with Manmeet. Manmeet, ऐसे लग रहा है मेरे वाला सवाल पूछ डाला आपने। So, Manmeet भैया कह रहे हैं कि I lose a lot of weight every time I put in effort. 3 cheers for that. But every time I stop the effort, 3 back gears for that, then the weight comes rushing back. So, एक तो ये point है स्वप्ना जी मनमीत का, and we take the second part of his question later. So, what's your comment on this? I lose a lot of weight when I try, but every time I stop trying, the weight comes back. आपकी लाइफ में क्या चल रहा है?
सर एक्चुअली वेट लूजिंग मतलब वेट लॉस जर्नी ऐसा है कि आप एक कांस्टेंट वेट कम कर सकते हैं, जैसे 10 किलो 15 किलो वजन कम कर लिया है, फिर उसके बाद में आपको लाइफ टाइम प्रोसेस है ये जर्नी। ऐसा नहीं कि आप वजन कम कर लिया और बैक फिर से पुराने लाइफस्टाइल में नहीं जाना है आपको। आपको वैसे ही जैसे आपको मेंटेन करना है बैलेंस डाइट रेगुलर एक्सरसाइज, उसको आपको मेंटेन करते जाना है, तभी जाके आपका वेट मेंटेन रहेगा। बाउंस बैक नहीं करेंगे, स्लोली एंड ग्रेजुअली आपको वेट लॉस करना है, धीरे धीरे करके इन सस्टेनेबल वे करना है। ओवरनाइट रिजल्ट एक्सपेक्ट नहीं करना है सर।
राइट। सो मनमीत, देखो स्वप्ना जी क्या कह रही हैं, एंड दीज आर वर्ड्स ऑफ अ सक्सेसफुल लेडी। एक बहुत ही सक्सेसफुल और आत्मनिर्भर महिला के वर्ड्स हैं, ये शब्द हैं। धीरे धीरे करना है, सस्टेनेबल वे में करना है, एंड जो भी आप न्यू लाइफस्टाइल अपनाते हैं, यू हैव टू कंटिन्यू दैट। इट इज अ लाइफ लॉन्ग जर्नी। नाउ मनमीत आस्क्स हिज सेकंड क्वेश्चन, ये गूगली है। इन्होंने इंस्पिरेशन ली फ्रॉम आवर इंडियन क्रिकेट टीम विच इज डूइंग वेरी वेल दीज डेज, एक्चुअली थैंकफुली। वो कहते हैं, हाउ कैन आई क्योर ओबेसिटी? If the Indian team can win 3 T20 series in a row, whitewashing their opponents, then I should be able to cure obesity as well. So can I cure? Can I manage? Uh,
यस,
ये पूछ रहे हैं वो।
पक्का सर क्योर कर सकते हैं ओबेसिटी को। आपको सिर्फ मतलब पहले तो आपको डॉक्टर के पास अप्रोच करना पड़ेगा। Doctor will rule out if any undiagnosed medical condition is there or whether it is their lifestyle. He will find out the reason behind obesity and accordingly he will advise him. Then he should also approach dietitian. They will tell him what to eat, what to avoid, and what is the moderation level, portion control. Like they will advise accordingly. And family support should always be there to decide healthy menu and physical activity. Like I would like to say him that priority is your health. Your health is your wealth, and I personally believe that self love is the greatest medicine, sir.
No,
Thank you. So
Dr. Sanjay, can I add something? Because we
yeah.
usually tell the patients to weight reduction need two things. One, it is dietary modification, and the other is to have exercise. So what I usually tell is that to walk for at least 1 hour and reduce carbohydrate. Usually, we in Kerala we eat lot of rice, so we tell to restrict to one diet and of rice and don't take in between snacks and so these are the two aspects. So I just want to ask Sapna, what is the thing which you feel because you have experience of weight reduction, which is most important out of this way, diet restriction or exercise, or both? What do you feel?
Sir, both, sir. We have to restrict our diet also. We have to have a balanced diet. Like I used to have 6 meals, like three small meals and small snacks. Also, I used to have healthy snacks. Like I am a working person. Like in the morning, if I used to have a breakfast, for one serving of upma and 100 ml of tea, and again in by 11:30, I used to have one fruit, and by 2 p.m. in my lunch, I used to have 1 cup of rice, small cup of rice, 2 cup of dal, one chapati, buttermilk. I used to start my food like having a glass of buttermilk, then one bowl of salad, then one chapati, sabzi, one small cup of rice and dal. Likewise, and by again 4 p.m. I used to have 100 ml of tea. Then by 6, I used to have a small amount of nuts like badam or groundnuts likewise. In dinner, I used to have ragi porridge. For almost 2 years, I had ragi porridge. Actually, my doctor prescribed me a meal replacement, but I wasn't happy about that and I didn't like the taste of it. So I started having ragi porridge. My mother used to prepare ragi porridge for my dinner, and I had it for almost 2 years. Then, like exercise, I used to wake up early in the morning and I used to do yoga, cycling, and to shift focus from food cravings and cooking, I used to do gardening also. So
Okay.
both diet and exercise, both is needed to reduce your weight. And I have reduced my stress level. Good sleep is also most essential, sir.
Okay, that's a good
That's
motivational thing because to hear from somebody who has really done it, no. I think the one important message what you told is that instead of just fasting, adjusting your meal, and so that in the small meals, so that you rightly balance. That is a good message, I think. No?
Yes, sir. Actually, my doctor, my physician, Dr. Nathan Kapoor, CNC Vellore, he advised me to like take simple meals, healthy dishes, and do simple exercise regularly. He never asked me to do fasting or take meal replacement or do 45 minutes exercise and one stretch. He always used to say me that split your exercise time.
Good.
so स्वप्ना जी, what you are saying, ये मैंने बचपन में कहानी पढ़ी थी. Dr. Aparna, your take on this. There was this story of a tortoise and a hare. So what Swapna ji is saying, slow and steady wins the race.
Right.
Your
Uh,
opinion?
sir, I agree with this to a large extent. बट एक थोड़ा सा इसमें मैं डिफर करूंगी कि एक हमको डिजीज को भी समझना जरूरी है. सो just like diabetes, there are patients who will respond very well to, say, a certain oral hypoglycemic, and we also have cases where you can experience reversal of diabetes with dietary management. एंड देन देयर आर पेशेंट्स जो आप लाख जतन कर लो लेकिन फिर भी वो बेचारे इंसुलिन पे चले जाते हैं, इंसुलिन बढ़ती चली जाती है. सो देयर इज a concept about the aggression of the disease in a particular person as well, and same is true for obesity. So there will be people who will respond very well to diet and lifestyle modification, and of course it also depends on the patient कि वो कितना effort डाल रहे हैं और कितनी consistency से उसको कर पा रहे हैं. But there will be patients जो सब कुछ करने के बाद भी respond नहीं कर रहे हैं, and that may not be because of a lack of effort. It may be because of the aggression of the disease. So I think it is important कि हम disease को grade करें और उसकी severity के हिसाब से उसको treatment advise करें.
So of course, first of all, you जो मैडम कह रही हैं वो सही है. First of all, you suspect obesity, then you screen for it, and then you stratify. All people who live with obesity are not the same. And Swapna ji ने भी कहा था, first you meet a doctor, see if there is a cause. There might be a secondary cause of obesity,
Yes.
and then you move on with the treatment and with living life healthily. Dr. Louis, you had spoken about PCOS, polycystic ovary syndrome. So, what is this disease? How common is it in women?
That's what I told. Right now, if you do the scan in the females less than 32 years in the reproductive age group, polycystic ovaries will be there in 20% of females. But you always compare and tell when you counsel the patients. You tell as a imagine ovaries as a coconut tree. So initially, that coconuts will be in a small size. Then few become in the intermediate size, and very few becomes the mature coconut. So in polycystic ovaries means the ovaries is full of like that small coconuts. But in most of them, that the coconuts, few coconuts will become mature. That is, at 1 month, that is one egg will be forming. So once the ovulation is occurs in the female, after 14 days, periods will come. That is how the usually the cycle periods are menstrual cycles are regular. But if that ovulation is not taking place, that means periods are won't come. So suppose if the female is having a menstrual cycle of 28 days, ovulation is occurring in 14th day. Suppose if it is coming on 38 days, that cycle female adds ovulation on the 24th day. That is how the relation with the ovulation and the menstrual cycle. Suppose in few of this PCOS, the ovulation won't takes place, then the cycles will become irregular. So that is how it is related to infertility. So, but if you take polycystic ovary, there are obese PCOS and lean PCOS, but majority is obese PCOS. Obese PCOS, the main thing is because of that blood level changes of the insulin, then hormonal changes occurring because of obesity. That is affecting the ovulation in those patients. So definitely in those patients, if females comes to you, we have, if there is regular cycles and is it obesity and the ovaries are PCOS, definitely dietary modification and the weight reduction is the first line of treatment. And if that has along after that, after waiting for 3 or 4 months, only start the proper ovulation treatment or the infertility treatment, because otherwise you will have it will become more expensive, it may not be response. So the counseling part is very important. The other side, what is happening is that now because of some reason, the ultrasound facilities there in almost all the small towns also across even our country. So they must have done some scans in their lifetime. But if the ovaries are PCOS, the sonology report will come as that ovaries are polycystic ovaries. So the most of the patients, when they come, they tell that I have having PCOS, but their cycles may be regular. If the cycles are regular, we need not have to worry too much. But still, if you after some time, if the more ovulation is not taking place, is different. You have to go for look for other causes and treat. But otherwise, if the infertile patient's cycles irregular with obesity, and we have to look for polycystic ovaries and treat that. So, and out of that, main thing is that weight reduction and dietary modification is the mainstay.
सो दैट्स वेरी इंपॉर्टेंट। डॉक्टर साहब ये कह रहे हैं कि पॉलीसिस्टिक ओवरी सिंड्रोम पीसीओएस बहुत कॉमन है विमेन में। इट कैन कॉज ओबेसिटी, इट कैन बी एसोसिएटेड विद ओबेसिटी, मगर ट्रीटमेंट फिर से वही रहता है, सबसे पहले डाइट एंड एक्सरसाइज, उसके बाद बाकी चीज़ों का सोचें। अब देखो, स्वप्ना जी भी कह रही हैं डाइट एंड एक्सरसाइज, लुइस साहब भी कह रहे हैं डाइट एंड एक्सरसाइज, और डॉक्टर अपर्णा कह रही हैं डाइट एंड एक्सरसाइज, एंड साथ में देखें क्यों हो रही है ओबेसिटी और कितनी है, शायद हमें सर्जरी की जरूरत पड़े। अगर आप सिर्फ डाइटिंग करेंगे तो क्या होगा? इफ यू ओनली डाइट, इफ यू डोंट एक्सरसाइज, आप पतले तो हो जाएंगे मगर आपकी मसल्स भी पतली हो जाएंगी। यू विल एंड अप वेस्टिंग ऑल योर मसल्स। तो एक डिजीज है जिसका नाम है सार्कोपीनिया, इट इज कॉल्ड सार्कोपीनिया। तो सार्कोपीनिक ओबेसिटी मीन्स कि वैसे तो आप मोटे दिखते हैं मगर आपकी मसल्स बिल्कुल गायब हैं। तो अगर हमने मसल्स बिल्डअप करनी है तो एक्सरसाइज इज इंपॉर्टेंट, दैट इज वाई बोथ आर नेसेसरी। Dr. Aparna, what are the kind of patients that you see and what are the comorbid conditions that they have? तो सपना जी एंड बहुत सारे लोग ये क्वेश्चन पूछ रहे हैं, व्हाट आर द अदर डिजीजेस दैट कम अलोंग विद ओबेसिटी? ये
So,
भानुमति का कटोरा है या पेंडोरास बॉक्स है, व्हाट इज इट?
it is truly a Pandora's box, sir. So, obesity actually it's a root cause of many diseases, and we can classify them into metabolic problems, mechanical problems, psychosocial problems, and other problems. So, metabolic, you are a endocrinologist yourself, and you know already कि obesity, diabetes, blood pressure, triglycerides, hypercholesterolemia, हार्ट डिजीज, ये सब चीज़ों के साथ में बहुत ही क्लोजली एसोसिएटेड है। इनफैक्ट ओबिसिटी एंड डायबिटीज इज टुगेदर नाउ नोन एज डायबेसिटी एवरीवेयर। Then are the other issues like I think एक सबसे important जो है liver health, that is very important. फैटी लिवर की एक डायग्नोसिस जो हमें अल्ट्रासाउंड में मिलती है, जिसको हम यूजुअली इग्नोर कर देते हैं कि इसको कुछ करने की ज़रूरत नहीं है, बट वो भी ओबेसिटी के साथ काफ़ी क्लोजली रिलेटेड है। एंड जब ज़्यादा ओबेसिटी होती है, सिवियर ओबेसिटी, we see that it progresses quite fast to something called as non-alcoholic steatohepatitis, which is NASH. And today, whether we believe it or not, cirrhosis of liver का जो main cause है वो obesity है actually, more than alcoholism also. And then respiratory issues like obstructive sleep apnea, then mechanical problems like joint issues. So जितने भी हमारे पास senior citizens आते हैं जिनका weight ज़्यादा होता है, उनकी सबसे बड़ी problem mobility होती है, because they just can't walk because of the weight. And orthopedic surgeon के पास जाते हैं, वो बोलते हैं कि आप पहले weight loss करिए. Weight loss करेंगे कैसे, क्योंकि चल ही नहीं सकते हैं. So it becomes another issue altogether. Then, like sir has already spoken about reproductive health, so we also see a lot of patients who infertility, मतलब with long duration infertility, and there is no proven cause for it. Many cancers are associated with obesity, especially endometrial cancer, breast cancer, and colorectal cancer. So, gout hai, or psychosocial problems. So, we all know that the rate of depression is much higher in patients with obesity and so on. So, it is like it's a time bomb. मतलब आप बैठे हुए हो इन सारी diseases के ऊपर, and the risk is high. So, not everybody may have everything. But yes, the risk as compared to normal weight population will be much higher for developing these problems.
So, मल्टीपल इश्यूज, सब लोग आप क्वेश्चन पूछ रहे हैं, मल्टीपल इश्यूज जो ओबेसिटी के साथ होती हैं, मेटाबॉलिक, मस्कुलोस्केलेटल, मूड रिलेटेड, मटर्निटी रिलेटेड, प्रेगनेंसी करना मुश्किल है, मैस्कुलिनिटी रिलेटेड ऑल्सो, डॉक्टर लुई ने बात की थी, सीमन क्वालिटी भी कम हो जाती है, सेक्सुअल फंक्शन कम हो जाता है। ये एम्स ही काफी नहीं है, और भी एम्स हैं। एम फॉर मेलिग्नेंसी,
Yes.
एम फॉर मॉर्बिडिटी, एंड एम फॉर मित्रता। So, living with obesity, have you ever felt state society is very supportive? So, what impact does living with obesity have on monetary health, money, and also on mitrata, on social interaction?
Sir, is this question for me? I'm not able to hear the question, sir. Can you
हाँ
repeat
जी,
the question?
living with obesity, फाइनेंशियल हेल्थ पे क्या इम्पैक्ट पड़ता है?
Financially, sir, if they are going for knee replacement and like that, or surgery, then it will cost more. But in my case, I didn't go for knee replacement or anything else. I slowly, like in 18 months, I lost 15 kg. So actually, it was very much hard work from my side and discipline.
सो फाइनेंशियल इतना इम्पैक्ट नहीं पड़ता। डॉक्टर अपर्णा, आपके पास जो पेशेंट्स आते हैं, एंड अनदर क्वेश्चन इज, हाउ डू आई नो वेदर आई नीड बैरियाट्रिक सर्जरी? तो दोनों
Sir,
क्वेश्चंस अगर आप
so
इकट्ठे ले लें, हाँ, हु नीड्स बैरियाट्रिक सर्जरी एंड व्हाट इज द फाइनेंशियल इम्पैक्ट?
सो सर, फाइनेंशियल इम्पैक्ट डायरेक्टली भी होता है, जैसे सपना ने कहा कि इट मे बी बिकॉज ऑफ द कॉस्ट ऑफ द ट्रीटमेंट पर से, but I think financial impact also needs to be assessed in terms of bias that is faced by these patients, even in job settings. So I get a lot of patients who are actually working for big companies, and many times they are, not promoted just because of their physical appearance, or काफ़ी मतलब differentiation लोग experience करते हैं. That is one thing. Second thing is financial impact also has to be assessed in terms of फ्यूचर हेल्थ. सो आगे जाके जो लोग अगर वेट लॉस नहीं कर पाते हैं, तो क्या उन्हें नी रिप्लेसमेंट सर्जरी लगेगी, क्या उन्हें कार्डियक सर्जरी की ज़रूरत पड़ेगी, क्या उनको किडनी रिलेटेड कोई इश्यूज हैं, डायबिटीज़ में कितना एक्सपेंस हो रहा है. सो ऑल दैट ऑल्सो नीड्स टू बी assessed, and it needs to be a long thing. As far as qualifying for bariatric surgery, I think it is, yes, we do have guidelines. So, according to the guidelines of Obesity and Metabolic Surgery Society of India, anybody with a BMI of more than 35 is technically eligible for a bariatric surgery. But it needs to be assessed clinically. So, of course, I mean, it's not only just the BMI which is counted, but we also have to see if there is any other associated issues, obesity से इंसान को कितनी तकलीफ हो रही है. So there are many people who may be BMI 35, but they may be happy with it and they may not have any issues. And we may actually give them a chance to work out and try other methods before trying surgery. Um, but as per the guidelines, above 35 BMI, you are technically eligible. Above 30 BMI, if you have two additional comorbidities like diabetes, hypertension, heart disease, or obstructive sleep apnea, or anything else, then also you qualify for surgery. So, and the third इंडिकेशन इज दैट अगर बीएमआई कम है लेकिन अनकंट्रोल्ड डायबिटीज है विद ऑप्टिमम मेडिकल मैनेजमेंट, तो भी हम सर्जरी कंसिडर कर सकते हैं, पर ये बहुत कम इंडिकेटेड है. और बेरियाट्रिक सर्जन्स पर से आई थिंक इसको बहुत कम प्रैक्टिस करते हैं, बिकॉज वी यूजुअली हमारे जो पेशेंट्स होते हैं वो 40-45 बीएमआई के ऊपर ही होते हैं.
तो जो मैडम पॉइंट रेज कर रही हैं वो बहुत ही इंपॉर्टेंट है. You may feel that obesity management is expensive, but the management of obesity complications is much much more expensive. तो obesity का इलाज करना फिर भी सस्ता पड़ेगा. स्वप्ना जी ने डाइट एंड एक्सरसाइज से किया, डिसिप्लिन से किया. कुछ एक लोग बैरियाट्रिक सर्जरी से करवाते हैं और कुछ मेडिसिन भी ले सकते हैं. वी हैव इंजेक्शंस, वी हैव कैप्सूल्स दैट वी कैन यूज. तो ये बहुत ही सस्ता पड़ता है एज कंपेयर टू द कॉम्प्लिकेशंस ऑफ ओबेसिटी. अगर आपको हार्ट की बीमारी, किडनी की, घुटनों की बीमारी हो जाए और उसको ट्रीट करना पड़े, द कॉस्ट विल बी मच मोर. Dr. Louis, does the same thing hold true in the infertility setup? Women who have lesser weight, who have normal weight, do they respond more easily to treatment and is the cost less? And let us say I am overweight, obese, I come to you for treatment, will the cost go up?
That depends on any other associated factors. Suppose even the just polycystic ovarian syndrome is alone the reason. Those patients, I think obese patients, if they do the weight reduction, they respond well. Or if there is obese, we need more hormones is needed. And I just want to ask Dr. Abarna also, and to emphasize the point you told about the bariatric surgery also. But what I have seen is that there are few instances, not all, few instances where they do the bariatric surgery, but they don't do the endocrine follow-up. So after 1.5 years, it is initially they may lose weight, but they will later and gain weight. So what in infertile patients, what I do is that after bariatric surgery, I wait for 1 year, and so that the proper weight reduction is proper endocrinology control is done, and then only go for a treatment. So that is my take for obesity with the bariatric surgery. So being an expert, I think you can add to that. And also, I think audience will be interested to know which type of bariatric surgery you advise. There are a lot of things being heard. So I think you are the expert with that.
Sir, completely agree with you that after bariatric surgery, according to the guidelines, a patient must conceive or try for conceiving only after about 18 months. Because before that, तो उनका खाना भी बहुत कम होता है, nutrition levels, like there is a whole lot going on in the first year. फर्स्ट ईयर में वेट लॉस का भी पीरियड होता है. अगर वो पहले ही साल में कंसीव कर लेंगे तो देन द वेट लॉस विल आल्सो नॉट हैपन. अनदर थिंग व्हाट वी ऑब्जर्व इज कि बहुत जल्दी कंसीव कर लेते हैं बेरियाट्रिक सर्जरी के बाद. सो वी एक्चुअली हैव टू give them specific instructions to take precautions, because we've seen people conceiving within 3 months, 4 months, and then it becomes a problem for us also. But the guideline is to conceive only after about 18 months of bariatric surgery. And yes, follow up is very very important. So I feel that bariatric surgery से ज़्यादा bariatric science बोलेंगे तो अच्छा है. It is exactly like management of any other chronic disease. So whether it is diabetes, hypertension or heart disease, जितना follow up अच्छा रहेगा उतने results अच्छे रहेंगे. अगर patient follow up बंद कर देता है या team की तरफ से follow up नहीं होता है, तो it is a chronic disease, and weight regain is a reality after any therapy for weight loss. So what we are doing is we are controlling the disease. We are not curing the disease. And diet and lifestyle modification will remain the cornerstone of any therapy for weight loss. So चाहे वो bariatric surgery करे, चाहे कुछ भी करे, लेकिन diet और lifestyle modification तो करना ही पड़ेगा. Second thing is that we also add drugs as and when required because patients weight regain के साथ वापस आते हैं. And our directive is कि आप ज़्यादा मत रुको. मतलब you do self weight monitoring. It's exactly like blood sugar management. So you monitor your self at home, and the moment you see कि control के बाहर जा रहा है, you seek help, and then we have to accelerate the therapy or escalate the therapy at that particular point of time. So bariatric surgery is not the end of the story. It's the beginning of the story, and it's a lifelong affair, basically.
So point well taken. And फिर से वो repetition आ रहा है. There are so many things that you can do to manage obesity. आप diet and exercise कर सकते हैं, surgery करा सकते हैं, tablets और injections ले सकते हैं, meal replacement ले सकते हैं. All of it has to be done together. जिसको जो ज़रूरत है वो होगा. But diet and exercise तो चाहिए ही चाहिए, and वो
Yes,
lifelong चाहिए.
absolutely.
Dr. Louis, Dr. Parna, and Swapna ji, greetings to you from Afghanistan as well. Dr. Noor Aga Danish is with us. And Dr. N.S. Sharda sir. Sir is a very senior physician from Ahmedabad. Sir is Dr. Louis advising all our patients, the ones with polycystic ovary syndrome, to use a grinding stone manually. So आप चपाती खा सकते हैं, शर्त ये कि आटा खुद पीसें. So you should grind the wheat yourself. एंड आप इडली भी खा सकते हैं जितना आपका दिल करे, शर्त ये कि वो राइस भी आप खुद उसको ग्राइंड करें. सो थैंक यू सर फॉर दैट गुड advice. Dr. Sharda sir also reminds us that it is difficult for many obese people and elderly people to exercise. So, uh, any suggestions, Dr. Aparna? Patients with morbid obesity, what are the simple exercises they can do to keep themselves fit?
Sir, it's a very difficult arena because actually one thing जो कर सकते हैं आराम से वाटर बेस्ड एक्सरसाइजेज होती हैं जिसमें नी के ऊपर कोई प्रेशर नहीं पड़ता है. स्विमिंग कर सकते हैं, लेकिन हर किसी के पास ये एवेन्यूज अवेलेबल नहीं होते हैं. सो बहुत बार एक्चुअली ये पेशेंट्स बेचारे कुछ भी नहीं कर पाते. एंड walking is out of question, any kind of exercise is out of question. It's just a little bit of home workout या yoga या फिर water based exercises. That's all that can be done. But these are usually not very effective for patients with issues related to joints and knee joint pain and morbid obesity. तो उससे काम बनता नहीं है पूरा.
So we should try our best. And let us say you are not able to lose weight. Maybe you cannot run very fast, but still you should exercise क्योंकि आपकी जो joints की range of movement है वो बनी रहेगी. And it's not just about losing weight, it is also about flexibility, about balance. तो कुछ ना कुछ करते रहें. Just keep your body active, keep it agile.
So what usually seen is that sometimes the working movement, it is difficult to do the exercise. It is difficult to them even to tell to walk for 1 hour. So what I usually tell is that suppose if you are going for work, if you are getting out in a stop, you just get down one stop before and go there. That make it a routine. Or household woman, we tell that you go to the temple daily, something like that, which can be utilized daily. It has to be counseled properly. That thought has to be given. Then only I think it will be easy to implement in a long fashion. And as Sapnaji was telling, no, something has to be sustained. Then only the effect will be there.
Basically
This
keep
temple,
moving.
yeah, carry on, madam.
I said basically keep moving.
Keep moving.
Yes.
This temple therapy, Dr. Louis, is very nice, and I learned this concept from a friend of mine. His name is Dr. Navneet Agarwal. He is a diabetologist who works in Gwalior in Madhya Pradesh. So he would prescribe therapy for diabetes. Some patients would take, some would not take, and they would keep on badgering him about alternative and complementary medicine. So he finally thought it is too tiring to fight alternative medicine. So he began fighting along with complementary therapy. So what he would say is that yes, madam, this drug will certainly help you control your diabetes, but there is a caveat. एक शर्त है. क्या शर्त है? You have to go to such and such a temple every day, and you have to do it continuously for the next 2 weeks before you come to show me. right? And he would choose a temple which is about maybe 1.5 kilometers away from that lady's house. And then he would say, आप मंदिर जाएंगे वो तो पैदल जाना है, you have to go on foot. Otherwise, the Shraddha is not there, the respect is not there. So the lady would go, and after 14 days, lo and behold, the sugar would come down. And then he would change, and he said, now, madam, I am changing your therapy. But the temple is also changing. Now you have to go to that temple, which is 2.5 kilometers away. So this is temple therapy. Thanks to Dr. Navneet Agarwal for teaching me this. And you can use exactly the same for mosque and for church therapy. It's exactly the same motivation. स्वप्ना जी, एक क्वेश्चन आपके लिए आ रहा है. आपने बात की फैमिली की, यू गॉट familial सपोर्ट. तो क्वेश्चन है, इज ओबेसिटी familial? Is Does everyone in your family live with obesity, or are they all able to fight obesity together?
सर पहले ओबीस थे, अभी जब से मैंने वेट लॉस किया मेरे फैमिली में सबका वेट नॉर्मल में आ गया है सर. माय फादर इज लाइक 67 kgs.
Wow.
My mother is like 71 now. My brother is 68. Like हमारे फैमिली में सबका वजन नॉर्मल हो गया है. मैं आई कंसल्टेड द डॉक्टर, मगर मेरा डाइट के वजह से वही खाना बनता था घर पे, सबको वही खाना है. मेरे फादर का HB1 10.8 था, अभी 7.4 है. लाइक माय मदर्स ब्लड प्रेशर इज नॉर्मल नाउ. उनको रोमेटिड आर्थराइटिस था, अभी वो नहीं है. अभी उनको उसकी कोई भी दवाई वो नहीं लेती हैं अभी. लाइक सबका हेल्थ अच्छा हो गया है.
So, Dr. Fesi, Dr. Parna, we should join in three
Very
cheers
good.
for the Jain family from Vellore in
Thank you
Tamil
sir,
Nadu.
thank you so much.
That is really, really nice. And I think congratulations to them for having reached here, and best
Thank
wishes to them for continuing that throughout life. And the Jain family is a real good role model for us. A question coming from Afghanistan is, in the Jain community, there is intermittent fasting. Also, now we will have the holy month of Ramzan. That is also intermittent fasting. Actually, many times I smile very quietly to myself when I see on internet so many people selling intermittent fasting as a modern concept and charging through the nose for that, just to teach you what IF is. And why I smile is because you just have to go to any senior Jain person or any believing Muslim, and they will tell you that Jain intermittent fast and Ramzan have been there for so many centuries. So that is how you learn. So and we get another best practice from Dr. Pawar. Dr. Ramesh Pal Singh Pawar, sir, is a senior pediatrician. Sir is 72 years old now, maintaining good weight, and he says along with diet and exercise, I do yoga every day. So thank you, sir, for that advice. So Dr. Noor Aga is asking us, how effective is intermittent fasting? Dr. Louis, do your patients practice that when they are planning pregnancy?
Even though I don't routinely do that, because it cannot have a consistent long-term effect. Okay? Sometimes they will be fasting, sometimes. But if somebody is so determined, I know one of my cousin, she did intermittent fasting and reduce weight, but you need much more determination, and sometimes there will be associated gastritis, especially if we are taking some other medicines for infertile patients, like if you are taking metformin or something, that will really produce gastritis along that. So those patients, it is not wise. Otherwise, if you are determined, and it is a sort of fasting, as told, no, if you are so determined, we can try that. But I don't advocate that much for intermittent fasting, because how far they will implement, I'm not sure about it. I think Dr. Aparna can add to that point, and Sir also, if you also can add, I think your experience with that.
So
So,
Dr.
sir,
Noor,
act- sorry, sir.
carry
आप
on. No, carry on, carry on.
नहीं, एक्चुअली हमारे पास जो पेशेंट्स आते हैं, दे हैव एक्चुअली ट्राइड एवरीथिंग, एंड a lot of them have actually benefited from intermittent fasting also. But like you said, कि it depends from person to person, कि किसको, some people can tolerate, some people are not able to tolerate because of various reasons. But like Sapna said, that whatever is done, it has to be done consistently. And beyond a point, I think our bodies also get used to a certain diet, and then it stops having an effect. So we have to keep challenging the body with different kind of things at different intervals. So, but otherwise, I am totally for an early dinner, and like जो Jain system hai of having dinner before sunset. I think that is one of the best systems to follow, and have an early dinner, early to sleep, early to rise. I think that's the best way to follow for a good health.
स्वप्ना जी, आपने फास्ट किया इन योर
Yes,
जर्नी
sir.
टुवर्ड्स वेट लॉस?
Yes, I do fast, sir. चातुर्मास
तो
में वही फेस्टिवल्स में फास्ट करती हूँ, नवरात्रि में फास्ट करती हूँ सर। लाइक फ्रूट इनटेक्स, juice मतलब lemon juice, not any other fruit juice. Lime juice I take. Otherwise I take whole fruits. I don't take two juices. Whole fruit.
राइट, सो इंटरमिटेंट फास्टिंग may help some people, it may not help others, but अगर करना है तो we should be consistent with that. And by chance, if you happen to be living with diabetes, do consult your doctor, because there are some drugs which can cause low sugar, hypoglycemia, and then there are others which are safe. तो अगर आपने फास्ट करना है तो आप डॉक्टर से पूछ के अपनी दवाई बदलवा लें. Also, let us take the opportunity to remind ourselves that next month is Ramzan, just 1 month left. So, if you're living with diabetes, do reach out to your doctor and see if any drugs need to be changed. Even if you have heart disease, heart failure, hypertension, still your drugs may need to be changed. एंड केके मेड टॉक्स पे हम एक सीरीज रन कर रहे हैं ऑफ प्री रमजान एजुकेशन प्रोग्राम्स. 3 हम कर चुके हैं, वी आर डूइंग एवरी 2 वीक्स, एंड अब हमारे 14 मार्च और 28 मार्च, 14th March एंड 28th March, दीज आर आवर नेक्स्ट 2 प्रोग्राम्स ऑन प्री रमजान एजुकेशन. डॉक्टर अपर्णा, केदार जोशी सर हैं. सर इज़ अ वेरी सीनियर लिसनर एंड वेरी एजाइल, वेरी एक्टिव. सर कह रहे हैं कि आई एम 66 years old, मैं 66 वर्ष का हूँ. मेरा BMI 23 है, 23, मगर मुझे लगता है कि मेरा पेट थोड़ा सा बाहर निकला हुआ है. तो सर ये पूछ रहे हैं, आप सिंपल भाषा में एक्सप्लेन कर पाएंगे क्या? BMI 23 मीन्स कि मैं ओवरवेट हूँ, बट बहुत ज़्यादा भी नहीं हूँ, ठीक हूँ, और मेरी टम्मी निकली हुई है. तो ये सिर्फ, ये मैं नॉर्मल हूँ क्या एज एन इंडियन, और मैं इसका कुछ करूँ या ना करूँ?
Sir, BMI to normal range में it's a little bit on the higher side, but I think we can consider it perfectly normal. ये एक टिपिकल इंडियन मेल का जो लुक होता है कि एकदम पूरे थिन होते हैं लेकिन सिर्फ टमी थोड़ा सा होता है. सो अगर एक हेल्दी डाइट और थोड़ा सा कुछ भी एक्टिविटी हर रोज करेंगे तो आई एम श्योर ही कैन गेट द बेली अंडर कंट्रोल. ऑफ कोर्स आई डोंट नो कि और कुछ मतलब शुगर इनटेक और अल्कोहल इनटेक वगैरह अगर कुछ है और उसको कम किया जा सकता है तो इट विल मेक अ वर्ल्ड ऑफ डिफरेंस. बट आई थिंक we don't have to aim for perfection only. अगर आप healthy हैं, fit हैं, सब काम ठीक से हो रहा है तो I think we can be okay. If you can be fit and healthy and you can walk around properly, do your daily activities, I don't think there is any reason to worry.
सर हमारे बिल्कुल सात्विक सर हैं, जोशी सर, और एंड ही इज वन ऑफ द फिटेस्ट पीपल यू विल एवर एनकाउंटर. सो
हाँ,
सर
तो
आप
फिर
बिल्कुल
कुछ भी
मस्त हैं.
इतना नहीं सोचने की जरूरत है सर.
एक इंग्लिश वर्ड है बैरोमेनिया. सो बैरोमेनिया, डॉक्टर फेसी, योर ओपिनियन ऑन दिस. नाउ there are some people who are obese, right? Maybe the ladies come to you for treatment, and they just get a label of PCOS, polycystic ovary syndrome, or PCOD, and then they sit back and say कि I have a reason, now I'm not going to do anything. सब गलती PCOS की है. It is all the fault of my ovaries. Nothing can be done. Now I have an excuse not to exercise, not to diet. That is one end of the spectrum. The other end of the spectrum is someone who is fine. I mean, a BMI of 23, doing well, healthy, beautiful. And just because there is pressure from society, pressure from peers, they go into something called baromania. They become manic, they become excited about their weight, and they keep on thinking about it all the time. Another रिफ्लेक्शन ऑफ दिस इज समथिंग कॉल्ड ऑर्थोरेक्सिया नर्वोजा. नर्वोजा मतलब आप नर्वस हो गए, आप अपने अपना अपना मूड बदल दिया, दिमाग खराब कर दिया. ऑर्थो मीन्स अपराइट. जब भी आप खाना खाते हैं सबसे पहले आप देख रहे हैं कि जी इसमें 12 कैलोरीज हैं या 14 हैं, या इसमें 2 ग्राम प्रोटीन है या 2.2 ग्राम प्रोटीन है. सो डॉक्टर लुई, इन योर ओपीडी डज दिस प्ले आउट, बैरोमेनिया, ऑर्थोरेक्सिया नर्वोजा?
Yeah, I don't think that like that patients we don't get much, but definitely as you told, I also was telling that patients attribute everything to the PCOD. That's what I told. Somewhere, some the they must have done the scan in the past 3 to 5 years, and the radiologist must have described ovaries uterus normal, ovaries PCOS. So they will the moment they come into your OP, they will tell that I am PCOS. So that is one spectrum. The other spectrum is that those who are really obese, those who are really PCOS. So those patients, definitely we have to even both the patients. I just the first part of the visit of infertility visit is that I spend more time so that I explain to them with the picture how the ovulation occur, how the fertilization occur, how the periods comes after the ovulation. So if your periods are regular, you don't have to worry too much. So if the periods are irregular, and that may be because of ovulation, and obesity means you have to control that. That's the first thing I tell that. So for that to have a little more, what we see is that usually the picture, not all cases, some cases before the marriage, these PCOS females will be maintaining their weight, or after the marriage, sometimes they will be increasing the weight. So I just asked how long the periods were irregular, and suppose it has been whether it is associated with marriage or with the weight gain. So I will, if the irregular period started 2 years back, then I will ask whether how was your weight during menarche and how is the weight now. So that clearly give them an insight that weight gain is really associated with the ovulation problems, and irregular periods is associated with the ovulatory problems. So that's how when you explain, that will be a motivation for them to have a weight reduction rather than attributing everything to and tell that then now you treat. And even if it is PCO, we have to tell that the cost of the treatment, the chance of success of the treatment, everything comes down with if there is a obesity. So those things we have to counsel properly. But the other spectrum, what as you told about the baromania, that is not much seen in routine practice, because I mean somehow it is not that much seen that like that patients come very less to my OPD.
सो डॉक्टर लुई का एक्सपीरियंस ये है कि सभी कुछ लोग ब्लेम करते हैं पीसीओडी पे। तो जब आप एक्सप्लेन कर दें मरीज को कि ये ओवरीज का काम है, ये एग्स का काम है और ये ओबेसिटी की वजह से ये दिक्कत आ रही है, देन इट्स ईजियर टू सॉर्ट थिंग्स आउट। And it seems the same thing is true across the world, because from Afghanistan also, Dr. Noor Aga tells us that he advised a patient to lose weight, and her excuse was, I am hypothyroid, so I cannot lose weight, while actually her TSH was normal. So I think this excuse finding thing, the Hindi word would be baro bahana. So
Sir, I
bahana
would like
ढूंढते
to
हैं
add
हम, we
here
find an
something here.
excuse.
I would
So
like to add here, sir.
हाँ
Like
जी,
I am a thyroid patient, sir. From 2012, I am taking thyroid tablets, sir. So I have reduced weight. I am a good example for that.
well controlled. That's good. तो एक तो बैरो बहाना नहीं चलेगा किसी के लिए. That is a strong statement coming from Dr. Louis, Dr. from Swapna ji, and I think from Dr. Aparna as well. No bahana,
No bahana, sir.
no
Definitely.
bahana. And एक और लास्ट क्वेश्चन लेते हैं. It is time for dinner, I know, but question सबसे आ रहा है about breakfast. So Swapna ji, is skipping breakfast good for health? Does it help you in losing weight or does it worsen things?
नो सर, इट विल वर्सन थिंग्स सर. आपका मूड बहुत खराब हो जाएगा. सुबह तो अच्छे से ब्रेकफास्ट करना ही करना है सर. यू शुड हैव इन अ पोर्शन कंट्रोल, बट श्योर यू शुड हैव सर.
Okay, so breakfast is fine. Dr. Louis, your comments on lunch?
I just tell that there must be some lunch, whatever it is. As Dr. Sapraji was telling, the meal has to be taken on time. So if you are not taking on time, then your control of the meal differs. So breakfast, lunch, and dinner has to be taken, and depending on that, we have to adjust the carbohydrate, adjust the sugar content, everything that is different. So lunch is a must. Don't skip the lunch. But even though if you are restricting that, that is more important.
And Aparna ji, dinner.
Sir, I think जो भी meals हम ले रहे हैं ना, it is very important to eat on time. That is, I think, of extreme importance. And it is not only about eating; it's also about exercise, eating, sleeping on time, and remaining de-stressed. ये चारों चीज़ें जो है ये बहुत ही important है. And I think it goes a long way in anybody's weight loss journey. And Sapna is a living example with us over here.
Someone whom we can be very proud of actually, and the
Definitely.
best, and the best part is ये है health की definition. This is the definition of health. अकेले अपने लिए नहीं, not only for yourself, for oneself, but also for the entire family. You're an example, and you get the family to follow the right path. And now, Swapna ji, thanks to you, it is not only the Jain family, not only Vellore or Tamil Nadu, it is entire India and entire South Asia. Because
Thank you.
Noor Aga ji bhi hai, and I forgot to acknowledge Mansi Thapa. So we have Nepal also logged in today.
Okay, Sanjay sir, I think about now a lot of people have started taking keto diet, but it has got its own problem. I think it will be wise if how you will advise regarding that. So people don't know whether about it is just like people trying to follow different methods like intermittent fasting. They follow keto diet because you need not have to restrict the some foods in that. No? So can you highlight the dangers of that? Because audience will be interested because I'm not an expert to tell that.
So the question is fat diets, extreme diets हम follow करें या ना करें. तो अब देखें एक जो basic rule है, that is moderation, but it is also balance. So follow a balanced diet. बैलेंस डाइट मीन्स जो क्वेश्चन पूछा जा रहा है, नवीन शनॉय जी पूछ रहे हैं, प्रोटीन, कार्बोहाइड्रेट्स, फैट्स, सभी कुछ थोड़ा थोड़ा होना चाहिए. इंडियन डाइट्स इन जनरल आर मोर कार्बोहाइड्रेट फ्रेंडली. एंड आई लर्न अ न्यू इंग्लिश वर्ड रिसेंटली, डॉक्टर लुई, ओराइजोवोरस. We are an oryzovorous country. That comes from Oryza sativa, from rice. So we are oryzovorous, like you have carnivorous, herbivorous. So because we are fond of our rice, we are fond of our carbohydrates and also our sweets. So हैं भी tasty. अब क्या करें? Indian cuisine, Afghani cuisine is so tasty. Nepalese cuisine is tasty. What can we do? So but no bahana, huh? No baro bahana. So uh, we need to follow a balanced diet. We need to follow the right diet pattern. And if you go to any extreme, you will end up getting in trouble. You will get malnutrition. The Hindi word is kuposhan. Either you will run short of proteins, or you will run short of carbohydrates, or maybe fats, and something or the other in your body will suffer. It can be your brain, it can be your muscles, it can be your bones. कहीं ना कहीं प्राइस पे करना पड़ेगा. एंड जो सिंपलेस्ट तरीका है कि मध्य पथ, यू फॉलो द मिडिल पाथ. दैट इज व्हाट इज एडवाइज्ड बाय लॉर्ड बुद्धा आल्सो. सो यू डू एवरीथिंग बट डू इट इन मॉडरेशन. एंड देन यू विल फाइंड दैट वो रास्ता भी बहुत लंबा चलेगा. दैट इज द जर्नी ऑफ लाइफ. एंड बहुत ही सुखद, वेरी रिलैक्सिंग, वेरी हेल्पफुल. एंड यू विल रीच योर डेस्टिनेशन. जो मंजिल है, दैट इज गुड हेल्थ. सो वी विल रीच देयर. Swapna ji, in your life with obesity, have you sometimes been tempted? कभी दिल किया ये मध्य पथ से हटने का, to move away from the middle path?
नहीं सर, like I used to wear 4XL dress and now I have reduced to M. Like वो journey बहुत लंबा था, so I did not want to bounce back.
Back, okay. Because
So
there is one law.
I would like to say few lines from Tirukural,
हाँ जी.
tribute to my living land Tamil Nadu. Like it's மாறுபாடு இல்லாத உண்டி மறுத்துணில் ஊறுபாடு இல்லை உயிருக்கு. It means there will be no disaster in one's life if one eats with moderation.
So थिरुकुरल, मैडम एक बार बताएंगे, some of us may not be aware. थिरुकुरल एक बहुत ही
It's a
थिरु
poetic
means
verse
sir. हाँ, थिरु means
on
sir
moral.
in Tamil language. Yeah.
Yes,
So थिरुकुरल एक पोएम्स की बुक है जो कि
yes, sir.
क्लासिक है तमिल लैंग्वेज का, और उसमें मैडम कोट कर रही हैं. वुड यू वांट टू रिपीट अगेन इन बोथ तमिल एंड इंग्लिश फॉर अस?
Yes, sir. மாறுபாடு இல்லாத உண்டி மறுத்துணில் ஊறுபாடு இல்லை உயிருக்கு. It means there will be no disaster in one's life if he eats in moderation.
अगर आप मॉडरेशन में खाना खाएंगे, बिल्कुल मध्य वाला पथ फॉलो करेंगे, तो कोई डिजास्टर नहीं होगा, कोई गड़बड़ नहीं होगी, कोई बीमारी नहीं आएगी. That is a very optimistic and a very happy note to close this KK Med Talks on. Today's KK Med Talks is to celebrate, to commemorate World Obesity Day, जो कि कल है World Obesity Day. और इस साल के World Obesity का थीम है Everybody Must Act. Obesity is too important to be left to any group of people alone. Everybody has to act, right from the politicians and policymakers to the physicians, the pharmacists, the paraprofessionals in medical profession, and of course to the public, to the people living with diabetes, the people living with obesity, and their peers and family members, their partners. तो इस बात पे सबसे रिक्वेस्ट करेंगे एक एक टेक होम कमेंट डॉक्टर लुई एवरीबडी मस्ट एक्ट and our topic for today is living with obesity. What message would you want to give to everyone who is watching us today?
Suppose if you have obesity in females, if there is irregular cycles also, don't wait for the, as an infertility specialist I'm telling, don't wait for the marriage to occur, and if pregnancy is not occurring to treatment, you must start from the adolescent time itself. Especially now the junk foods are more, so the and the TVs or mobile usage is more, so the it is life is becoming more sedentary. So the importance of obesity, or in the problems with obesity, has to be to tackling that has to be counseled right from the adolescent age. So adolescent age means it has to be from your house only. So how the parents teach them, that is important. But it has to be in the other way also. When we had in our gynec association, one of the gynec societies in cities, we went in extensive classes for the adolescent and children about polycystic ovary. But that became initially we had to be counseled properly, because when they went home and they so that's little hirsutism I'm having, little pimples I'm having, so like that hyperandrogenic features, lot of things they were having, and some students got really worried, and it started affecting their studies. So when we counsel properly, it has to be in a subtle way, and it has to be start from your home. So the parents also has to be counseled, so that it has to be started from the adolescent age onwards, about the how you tackle the obesity and how you change your lifestyle modification. Diet has to be started. I think good example is Sapnaji is here, so like that examples will be very important. So dieting in doesn't means you are fasting. You have to adjust your diet and adjust your lifestyle. That must be the main message in this World Obesity Day or associated episodes must be conveying to the general population in all, as a total.
थैंक यू। तो सिंपल वर्ड्स में गुड हेल्थ बिगिंस एट होम, तो पहले घर पे शुरू करें, एंड साथ में गुड हेल्थ बिगिंस इन चाइल्डहुड एंड एडोलेसेंस, तो बचपन में ही शुरू करें। डोंट वेट अंटिल यू आर एन एडल्ट बिफोर ट्राइंग टू फॉलो अ हेल्दी लाइफस्टाइल। डॉक्टर अपर्णा, योर मैसेज फॉर ऑल द ऑडियंस।
Sir, definitely agree with Dr. Lewis that obesity का prevention सबसे ज़्यादा important है, and it starts from home and school. So a healthy lifestyle, good diet, healthy exercise, and everything is very important. But on at the same time, अगर आपका weight फिर भी control नहीं हो रहा है, so then you need to seek help, and don't be shy of seeking help from a qualified weight loss specialist. I think a dietitian would be the first person to go to, and then from there on you can be guided further as to what needs to be done later. And but get treated. Don't let it just pass by, and don't lose time.
सो थैंक यू। तो अगर वेट ज़्यादा है तो डू रीच आउट टू द हेल्थ केयर टीम, टू योर डाइटिशियन, टू द एंडोक्रिनोलॉजिस्ट, टू द फिजिशियन, जो भी आपके पास है, एंड दे विल हेल्प यू, दे विल रेफर यू टू द राइट पर्सन। अगर बैरियाट्रिक सर्जरी चाहिए तो वहाँ रेफर करेंगे, अगर दवाइयों की ज़रूरत है, इंजेक्शन या टैबलेट्स की, तो वो देंगे, और अगर डाइटरी सपोर्ट और एक्सरसाइज हेल्प की ज़रूरत है तो वो किया जाएगा। We also have now digital therapeutics in the country. So even if you do not have direct access to an obesity specialist, you can always reach out to a digital company जो online आपके साथ बात करेंगे, dietitian, exercise physiologist and psychologist, सब लोग आपकी मदद करेंगे in your journey towards weight loss. स्वप्ना जी, लास्ट कमेंट आपसे लेंगे। लिविंग विद ओबेसिटी, लिविंग इन अ हेल्दी मैनर विद ओबेसिटी, क्या कहना चाहेंगे पूरे इंडिया को, पूरे साउथ एशिया को?
Sir, prioritize yourself. Your health is your wealth. Self-love is the greatest medicine. And in this platform, I would like to thank my physician, Dr. Nitin Kapoor, CNC Vellore. He has changed my life for better. I give my entire credit to him, sir.
डॉक्टर नितिन को हमारी तरफ से भी शुक्रिया कहेंगे। और आप सबको शुक्रिया कहूँगा, धन्यवाद, मेहरबानी फॉर हैविंग जॉइंड अस टुडे। इट्स बिन ग्रेट हैविंग यू डॉक्टर लुई, डॉक्टर अपर्णा एंड सपना जी। ये आज हमारा 600th एपिसोड था केके मेड टॉक्स का। एंड केके मेड टॉक्स इज ऑल्सो वर्क इन प्रोग्रेस, सपना जी, जैसे आप कहते हैं, वी कीप ऑन वर्किंग टुवर्ड्स इम्प्रूविंग हेल्थ ऑफ आवर कंट्री मैन एंड वुमेन। हमारी तरफ से आप सबको एक छोटा सा सर्टिफिकेट ऑफ एप्रिसिएशन। प्रतीक, इफ यू कैन शो द सर्टिफिकेट्स वन बाय वन फॉर ऑल आवर respected faculty.
Thank you, sir.
Dr. Aparna, thank you, madam.
Thank you, sir. Thank you so much.
And the next, Dr. Fessy Louis, thank you very much for being with us.
Thank you.
And Swapna ji, बहुत बहुत शुक्रिया for joining us.
Thank you,
And
sir. Thank you so much.
from all of us who are gathered in KK Med Talks today, 3 cheers to the Jain family for showing us the way forward.
Thank you so much, sir. Thank you so much.
Thank
Thank
you.
you. केके मेड टॉक्स पे हम आपके साथ रोज हाजिर होते हैं 7 बजे, और मैं आपके साथ होता हूँ हर सोमवार और वीरवार। आई एम विद यू एवरी मंडे एंड थर्सडे। हमारा नेक्स्ट टॉपिक जो है वो होगा 7th of March को। एंड लाइक आई ऑलरेडी सेड, हमारे अभी 2 टॉपिक्स और बचे हैं रमज़ान एजुकेशन के। दे विल बी ऑन द 14th and 28th of March। तो हमारे साथ जुड़े रहें एंड लेट्स ऑल वर्क टुगेदर टुवर्ड्स अ हेल्दियर एंड अ हैप्पियर वर्ल्ड। Let us also take this opportunity to pray for peace in this world. अमन शांति की भी दुआ करते हैं, कामना करते हैं और प्रार्थना करते हैं। With all that message and hoping for an optimistic future, Jai Hind.
Thank you.
Thank you, sir.
Thank you.
Thank you.